Awesome. So as you just started joining us, I'm Megan Ocken. I'm the program director with Healthy Birthday, Count the Kicks. I'm so excited you're here. I'm going to give people 1 or 2 minutes to join, to keep joining, but go ahead and just keep plugging in the organization you represent, the county you're located in, because I'm in Iowa and I would love to know where you're coming from, what organization you represent, what kind of work you do. I think that's really important to know. So I'm excited that you're all here today, spending an hour with me and the Arizona Department of Health Service team. So we're super excited that you're here. Laura. Hi, everybody. Oh, Cecilia, thank you for telling me about Northern Arizona. It's cooler there than where you are. Oh, what's the temperature there? Is it like in the mountains? All right, we've got a good group here, guys. Awesome. I'm going to go ahead and get started so I can be cognizant of our time. Thank you again for spending an hour of your day with us today. We're so excited to be launching in Arizona. It's because of this partnership with the Arizona Department of Health Services that I'm talking to you today, that you're able to get free resources like this webinar, that you're going to be able to get some awesome Count the Kicks free educational materials that we'll talk about in a little bit. And so before we really dive in, I just want to take a moment and have a welcome message presented to you by Sheila Scholander, the Assistant Director of Division of Public Health at the Arizona Department of Health Services. So Sheila, would you like to say a few words?
Sure. Thanks, Megan. Good morning, everybody. I'm so excited to be part of this event to help launch and introduce the evidence-based stillbirth prevention campaign here in Arizona. Really want to thank you for joining us this morning to learn more about Count the Kicks. Count the Kicks has launched in 15 other states, and we are thrilled to launch it here in our great state. In Iowa, where the campaign began in 2008, there has been a 32% reduction in stillbirths. The success of Count the Kicks in Iowa and other states like Illinois and Nebraska is what we want to see here in Arizona. And that is why we are partnering with the Count the Kicks organization. So unfortunately, we lose close to 500 babies every year to stillbirth in Arizona. So this campaign has the potential to save 1 in 3 at-risk babies from preventable stillbirth. We look forward to this partnership and working with our community partners across Arizona to share this message with families throughout our state. Together, we have the potential to save 155 babies every year from preventable stillbirth. So we really, really want to thank you for your time today and for your work to help save lives throughout Arizona. I'll turn it back to you, Megan.
Thank you so much, Sheila. Thank you. Thank you, everybody, for joining us. I'm going to go ahead and turn my camera off for most of this, and then I'll turn it back on at the end. I just have some videos that I want to make sure play correctly, and I think that sometimes my video can be distracting. So obviously, you know what I look like, but here I am again. Like I mentioned earlier, I am the program director with Healthy Birthday. Healthy Birthday is the nonprofit organization that created Count the Kicks. So that's why you'll hear that quite a bit. But what we're talking about today is our evidence-based stillbirth prevention campaign, Count the Kicks. My contact information is on the screen there. I would love to hear from you. One of my favorite parts of this job is talking to the people that are implementing this, because I can educate and share it and talk to people about it, but you are what's going to make this successful. This information that you take with you today in your line of work is what's going to make all the difference to get to that stillbirth rate decrease that we want to see in Arizona. So my background is in public health. I have close to 15 years experience in public health. I'm really passionate about systems level change. So we'll talk a little bit about that today on how you can truly integrate Count the Kicks into your current workflow and just how simple and easy it is. I'm also very passionate about prevention education, especially as it relates to maternal and child health. I have 3 kiddos of my own and was able to use the app with my last one, who was born in 2018. And I just love it. I love the entire thing. The whole premise of this campaign is all about empowerment. and education. And so I'm so excited that you're here today, and let's get started. Oh, just a couple more housekeeping things. This is being recorded, and I will send out a webinar after this with the recording so you can share it with your team members, with a PDF of the slides and some other links we're going to talk about today. So first, I want to start off with a video, and I like to share this video for a couple of reasons. One, I think it does a really good job. If you're not that familiar with Count the Kicks, maybe this is the first time you're ever hearing about it, or you've heard about it, but you're still not quite sure what it is. This video does a good job of sharing more of what this is, how the app works, and how it can save lives. I also like to share this story because it's a feel-good story. This is about baby Ruby, one of our baby saves. And when I talk about baby saves throughout the presentation today, what I mean by that is when a parent has contacted us, our organization, and said, I was using your app, or I knew about fetal movement monitoring from my provider, from my NFP, from my WIC consultant. I knew what was normal for my baby, and that changed. So I spoke up, and baby's here because of it. Thank you. So that's what we talk about when we talk about baby safe. So this is baby Ruby's story. And I also like to share it because it goes to the power of that storytelling. Mom to mom storytelling is so important. Anytime you have a chance to share one of these videos that are on our website or our YouTube channel or on our app with your expectant parents, share them, because this is what they're going to remember. Today, when you walk away today, you're going to remember the name baby Ruby. You're going to remember that. And it's just a feel-good story that's going to put a smile on your face. I also reference it a couple times throughout the presentation. So let's learn more and hear about baby Ruby.
We're going to turn now to that GMA Parenting Alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Yeah, so that's baby Ruby, just a feel-good story. And I saw somebody had their hand raised. So feel free to use the chat and ask any questions as we go along. I will answer them all at the end, but I don't want you to forget your questions. So go ahead and put them in the chat or the Q&A, and I will be sure to answer all of them. So if you're having any technical difficulties, we can work through that too. You might need to log out and log back in. So we learned about baby Ruby. You learned a little bit more about the app. Let's just level set and make sure we're all on the same page of what we're talking about today. So we're talking about stillbirth, which is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. And on average, we lose around 23,500 babies every year in the United States to stillbirth. Miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy. And infant mortality is death of an infant before his or her first birthday. And on average, around 22,000 infants die every year in the United States. What I really want you to take away from this slide is the fact that we are losing just as many babies to stillbirth as we are to infant mortality, yet we rarely talk about it. Stillbirth is very much a taboo topic. It is a health tragedy, and I understand that. And I know how hard it is to talk about. But until we start talking about it, just like we're talking about the importance of lying your baby on its back to sleep and SIDS prevention. And this isn't to underscore all of the wonderful things that go to prevent infant mortality. What I want to do is showcase the fact that we're not talking about stillbirth as much as we're talking about infant mortality. And we need to change that. We need to be talking about it, because until we do, that number is still going to stay high. So today, what you're going to learn and what you're going to take away is going to give you the tools and resources to be able to talk about stillbirth and stillbirth prevention with your patients and your clients, and to know what resources are out there to have this conversation to potentially save at-risk babies from preventable stillbirth. So let's take a little bit closer look at the national data for stillbirth. So it's a lot more common than people think. 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. So Black women, it's 1 in 96. Hispanic, Latinx moms, it's 1 in 199. Indigenous moms, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Again, it's just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. If you take that 23,500 number and break that down by day, that's 65 babies a day. That is like a kindergartner, busload of kindergartners. That's 65 kids. We would be talking about that if we lost a busload of children. Why are we not talking about this? So I want you to feel comfortable talking about stillbirth prevention after you leave at the end of the hour. So that was national data that I just showed you, but let's take a moment to look at your data specifically for Arizona. So the chart to your left there, that line graph, is based on the most recent 5-year average of the stillbirth rate is 5.92. So what you can see there is from 2009 all the way to 2019, which is the data we have. So Arizona is that yellow line, that gold line, and then the national rate is that red line. So you can see there that you guys have been pretty linear for the past couple of years. You saw, it looks like a small spike there from 2018 to 2019. So like on average, Arizona loses around 490, 500 babies, like Sheila mentioned, every year to stillbirth. And we have the potential of saving 157 babies from preventable stillbirth. And I'll talk about what I mean by that in a minute. But I also have your race breakdown as well. So if we think back to the national data, this does mirror that quite a bit. For Black or African American women in Arizona, the 2019 stillbirth rate was 11.77. The American Indian or Alaskan Native was 8.23. Hispanic or Latino is 5.98. White 5.45. Asian Pacific Islanders 3.47. So clear disparities. And one of the things I've loved most about working with the Arizona Department of Health Services is the weight that they put on equity and inclusion and what they've created for you for tools and resources to serve the population that you work with. So we'll talk about that in a little bit, but I'm super excited about what you're going to see out there for tools for you to use within your communities. So when I keep talking about that, saving 1 in 3 at-risk babies, or when Sheila mentioned we've seen a 32% reduction in the number of stillbirths in Iowa, this is what I mean by this. So this is Iowa's data. So Count the Kicks was created in Iowa in 2008. And I'll talk about that here in a little bit, but you can see that dot there where it's one of the highest on record from this chart. So from 2008 to 2018, in that 10 years, we saw a 32% reduction in the number of stillbirths in Iowa. In the first 5 years of the campaign, we saw about a 39% reduction of stillbirths among African-American women. Public health officials have stated that there's nothing else going on in Iowa that would have made such a big impact, a decrease like this. It's not like every pregnant woman received doula care, which would be amazing. It's not like smoking rates among 3rd trimester expectant parents has gone down. In fact, that's increased, and that's a risk factor. Things like obesity have increased. So all of these other risk factors have increased, yet we're still seeing quite a big decrease in the stillbirth rate. So this is the only stillbirth prevention thing that's going on in Iowa that could have made such a big impact like this. And it is being studied. And like Sheila said, we do have that proof of impact in other states as well. So you can see the 2021 preliminary data is around 4.1 fetal deaths. Our lowest on record on this chart was 3.9 fetal deaths. You can see a couple outlier years like that. So some years like there might be us from a big syphilis outbreak or a pandemic, those types of things that can exacerbate stillbirths, they might fluctuate the yearly rate there. So that's why what we really want to pay attention to is that trend line. We want to see that decrease. So this is what we want to see replicated in Arizona. We want to see that trend go down. And with your help and your presence today and learning about this, that's exactly what we'll do. So as mentioned on the previous slide, there's a large divide when it comes to those who are most likely to experience a stillbirth. I think it's really important that we take a moment to share and talk about this on what are some of the contributing factors to this. And so I think we talk about this and we learn about it and we work to implement ways to get to a place where race is no longer a predictor of stillbirth. So researchers point to the following as causes for these disparities: systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society, and all that comes with it has led to real and pervasive health issues for Black women. Epigenetics, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes or high blood pressure, which are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what are we doing to reduce disparities in stillbirth outcomes? So, and then what can you do? We have an app in 14 languages. Once we get to that app screen, if you see a language that represents the community you serve that's not on there, let me know, because we want to make sure we're as inclusive as possible. And we want to make sure that we're reaching those most vulnerable of stillbirth with this information. We have culturally appropriate educational material. We have videos and printed educational materials and FAQs in multiple languages. We have a health equity director. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We are an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We improve programming based on lived experiences shared by people of color. And we're working within communities considered to be marginalized, and we're working outside typical healthcare settings. We've done faith-based projects, hairdresser, beauty salon projects, dentists. We've worked with dentists and federally qualified health centers. There's just a lot of different ways that we work within the community. So we have the data, we have that background. How is this an evidence-based program and how is this research-based? And so I'm going to just dive into a couple slides behind the evidence of the program, and then we'll get into the implementation of it. So if you really like reading research articles and sitting down and reading pages and pages of journals, that's amazing, and hats off to you. We have a whole page dedicated to our evidence on our website, so be sure to check it out. If you're not into reading research articles and you don't really like doing that, I do encourage you to at least read one. And if you only read one, this is the one I want you to read, the one you see on your screen. And I want you to read this because this is the one that started it all. And what I mean by that is the fact that we were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss, and they got connected through pastors and friends. And as they were meeting and grieving together and talking over coffee, and what they realized was stillbirth is a lot more common than people think. Here they sat, 5 women within the same small area, location, geographically wise, with the same outcome. And yet here they were being told it doesn't happen that often. In fact, I believe one provider told them that it was like getting struck by lightning, but there's less chance of getting struck by lightning than having a stillbirth. So here they sat, these women, and their goal was to make sure at least one family would not go through the pain and suffering. That was their goal, if they could just save one baby. So long story short, a couple of the founders were at a public health conference on stillbirth. And while they were there, they heard some researchers from a study from Norway that showed when expectant parents were educated on getting to know what's normal for their baby in the third trimester, that the stillbirth rate among this cohort of women in the study decreased around 30%. And so the founders hearing this said, that's amazing. Like, you know, Kit County's been around for a long time, but not the tools and resources to easily talk about stillbirth prevention and the importance of tracking fetal movement in the third trimester. So let's do that. Let's go back to Iowa with this information. Let's get additional research and work with Iowa Department of Public Health and create this research evidence-based campaign. And that's exactly what they did. In 2008, Count the Kicks was born. In 2009, Healthy Birthday was created as a nonprofit 501c3. And so this research study is truly the founding of this organization. And Dr. Ruth Fretz here was one of the researchers on the Norway study. She's also part of our medical advisory board. And she said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And that's what's really important and what I'm going to stress a lot with you today, the normal movement pattern. It's all about understanding what's normal for your baby in that pregnancy. So we'll talk about that here coming up. We were also named a best practice by the Association of Maternal Child Health Programs, or AMCHIP. They do a very thorough scientific review of leading maternal health programs. And so we have a whole practice bulletin and a handout on our website if you'd like to read that as well. We also know that the CDC Hear Her campaign, which I'm sure a lot of you are familiar with today, the Hear Her campaign is to reduce maternal mortality in the United States. And the CDC lists 15 urgent warning signs for pregnant women. And the importance of paying attention to baby's movement is one of the key markers. I also want to stress and share my number one question I get asked. I was just at a conference for the first time in 2 years. We went to an in-person conference for the obstetric gynecology conference in San Diego. And the top question is always, won't this increase anxiety? Won't I just get a ton of calls from expectant parents worried? And I am here to tell you that that doesn't happen. Kit counting does not increase anxiety in most pregnant women. This study found that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. We have also done our own study on our app users from the Des Moines University and the Harkin Institute. And what they found was that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers went on to say that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And the reason for that is because now you have data in your hands. You have data with our app, you have that intuition download in your hands to go to your provider or know when to go to your provider and say, this is not my baby's normal. I need to be checked out. So we now have a very educated expectant parent that knows what's normal for her baby and when to speak up when that changes. So some other benefits that I think people don't think about is the fact that this can also help reduce preterm birth rate. Fetal growth restrictions may be identified earlier. I think some people, what we really want to stress is the fact that if you go in with a change in fetal movement, it's not like you automatically have baby, right? They do testing. There should be a protocol in place for that provider to see what's going on with baby. Maybe they catch something going on with mom. We know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have had live births, regardless of the cause of fetal death. So any change of movement, if it's not your baby's normal, you need to go in and get checked out. 9 times out of 10, it's going to be perfectly okay. But we want to make sure we catch that one time, right? So this research article stated that due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So you heard me mention about the connection between stillbirth and maternal mortality and morbidity. You are 4 times more likely to experience this maternal death if you have a stillbirth. And so we recently pushed out a white paper that reviewed some the research studies around this. They talked firsthand accounts from American women about this. And so I highly recommend reading our white paper on this. You can scan that QR code, but I will also be sharing it in the post-webinar email, so you have direct access to it. So I think I'll highlight that one last bullet there that says, according to one study that's referenced in this white paper, more than 15% of maternal deaths within days of delivery occur in women who have experienced a stillbirth. So again, not only are we potentially saving babies from preventable stillbirth, but also saving mom's life. Okay, implementation of Count the Kicks. Again, we are a stillbirth prevention public health campaign. We're evidence-based and we educate expectant parents on the importance of tracking fetal movement through the use of our mobile app, which we'll talk about in a minute, or you can download paper charts on our website. It empowers expectant parents to speak up to providers if there is a concern. So why do movements matter? Movement is one very important way a baby communicates before birth. A change in a baby's movements can be an early sign and sometimes the only warning sign that a baby may give when in distress. So there's really 3 types of movements. I think we all really notice or think about that reduced fetal movement, but there's 3 I want you to be aware of as you're talking to expectant parents about this. So obviously the very, most common one is baby has fewer or no movements, they slow down, there's a reduction in movement. The second one to be aware of that we also track on the app is that baby may move, but the movements are softer or weaker. So the strength of those movements decrease. Again, very important to pay attention to that as well. And then the third type of movement is that sudden wild surge of movement can also be an important sign of distress. And I don't mean just like those fierce, like feels like a limb's poking out. What research has shown and what expectant parents and lost moms have told us is it's almost like an aggressive movement, like one huge aggressive movement of baby that wasn't their normal type of movement. So that's what we want to pay attention to. Again, it's going back to understanding what's normal for your baby and your pregnancy. So when should you start talking about this? I want you to start talking about this with your patients or clients in the 3rd trimester, right at the beginning at 28 weeks or 26 weeks if they're high risk. If you are a home visitor and you might see somebody at, for example, maybe you see somebody at they're 24 weeks pregnant and you're not going to see them again until they're 32 weeks pregnant, go ahead and tell them about this information, hand them a brochure, talk to them about downloading the app right when they get to that 3rd trimester. So then you can talk about it when they come back in during their 32nd week. And then talk to them about what is a kick. I know we're called Count the Kicks, so I think that's the idea that it's all only kicks, but really what we mean is any movement except hiccups, rolls, kicks, jabs, pushes. Hiccups are involuntary, so they do not count towards the fetal movement count. So this is it, how to count the kicks to be in tune with your baby and your body. This is what you can share with expectant parents. It's so simple. You can do it in 5 easy steps. First, you can track your baby's movements with our free app, which we'll talk about on the next slide, or download our paper chart, kick counting charts. Really stress to your expectant parents. You want them to count every day, preferably around the same time. They're going to time how long it takes their baby to get to 10 movements. And after a few days, they will begin to see a pattern of their baby, the average amount of time it takes baby to get to 10 movements. This is also when research says babies get into that sort of routine. So they're going to start to see that pattern. And then we want them to continue tracking every single day and empowering your patients and clients to call their provider right away if they notice a change in how long it takes their baby to get to 10 movements or the strength of those movements. So now one of my very favorite slides, and that's because I get to tell you as a presenter, probably the only presenter you'll ever hear say, take out your phones. I want you to take out your phone. I want you to go into your app store and search Count the Kicks. whether it's the Android or your iPhone, search Count the Kicks and find the little yellow clock icon and download it. It's completely free. And I want you to download it so you can see how easy it is to use. So you are able to pull out your phone when you're talking to somebody at a WIC nutrition appointment, when you're talking to somebody at their appointment, and say, look how easy this is. Let's download it together and walk through it together to get you set up. So again, it's completely free. There are no ads. It's in 14 languages. You see those languages on the screen there. It's available for Apple and Android products. So this is how it works. Once you sign in and you register and you're ready to start counting, so you've picked a time of day when baby tends to be most active, you sit down, you focus on baby. This is where bonding really comes in. You hit that start counting button, and then you tap the footprint when you feel baby move, whatever movement you want to start with. So that footprint there on the screen that you see, you tap it and a timer will start. You tap the footprint every single time you feel a movement, all the way until you get to 10. And then what happens is the app will show you a graph. It'll show you the average amount of time it takes baby to get to 10 movements. After a couple sessions, you'll start to see this graph. So it gives you the average amount of time and then the total time. And so you can see it's very visual. So it's right now for that example, that baby takes around 15 minutes and 24 seconds. Some days it's 17 minutes, might be 18 minutes some days. It's a very linear graph. That's what would be their baby's normal. So they know if one day they're counting, and for example, that shoots up because it took maybe an hour and 15 minutes, that graph is going to visually change, which is going to indicate to mom, expectant parent, to say, that's not my baby's normal. I'm going to call my provider and work with my healthcare team to see what they want me to do. And then they should come in and get checked out. So some other features of the app, you can restart a session or delete a kick. So let's say I'm counting, I'm focused on baby, and my 3-year-old runs up to me and says he's got to go potty, and I'm potty training. So I know I have to run him to the bathroom. So by the time I get back, 10 minutes has passed. It's going to mess up with it's going to mess my pattern and my average time. So I'm going to start over. Another great feature is you can set daily reminders. I cannot stress this enough with you. Please have your expectant parents set up daily reminders in the app. They don't have to go out to their calendar. They can do it within the app. It is imperative that they count daily around the same time every day, because that's how they're going to start to understand and see what's normal for their baby. You can review kick counting history. Another great feature that we found especially helpful in a pandemic, where we know that babies' movements, or not babies' movements, but that prenatal appointments got stretched out, that there were a lot of telehealth appointments. They can download the history and share it with their provider. They could email it. They could put it in like a My Chart. They could share it with families and friends. How great is it to say to your provider, hey, look at this. I'm using this app to track my baby's movements. I want you to see it, empowering them to speak up to their provider, especially if their provider's not talking to them about it. And maybe their provider will then, or should then. You can count for single babies or twins. You can track future pregnancies on the same profile. You can manage multiple devices. So this is where we find significant others get really involved. They can download the app and sign in and see how their baby's been moving too. And they can track it along with the expectant person. You can also manage let's say I'm counting on my iPad and the next day I'm counting on my iPhone. It's all syncs. And then now it's also available on Apple smartwatches. So you could be lying in bed, you get that notification that says, hey, it's time to count your little kicker because I set up a daily reminder. And my phone is on the dresser and I am 8 months pregnant and I don't want to get up to get it. So I'm just going to count on my watch and it's going to sync automatically to my phone. So hopefully you downloaded that while I was talking and have been messing around with it, because there's another feature I want to highlight. And this is our strength tracking and notes feature. And so if you remember at the beginning with baby Ruby's story, she mentioned how movements just felt weaker, they felt softer. This is where this comes into play. We want expectant parents to track the strength of those movements that happened. So like this, you were tapping the footprint every time baby moved. So after you get to 10, what you're going to see as a user is that second image that says, almost done. Please fill out the following fields to finalize your kick session. So then expectant parents have the opportunity to say those movements were really light, they were fluttery, all the way to 5, which would be fierce, they were strong. There's kind of a guide for what each movement might be there with the information button there. But what's really important here for you to share with your expectant parents is the strength should not decrease, right? Like it shouldn't have a slight decrease over time or anything like that, or feel softer or weaker. So this is what tracks this, and it tracks it via a bar graph. So we have the line graph up there for the how long it takes baby to get to 10 movements, and we have a bar graph for the strength. So again, very visual. You can see this baby is usually 4 or 5 feet and pretty linear. So this example, the picture on the far right, this is an example of, let's say baby was pretty linear. You know, baby was counting, let's say it was like 5 minutes every time I got 10 movements. My strength was like a 4 or 5 every time. And then one day I counted and it took, 45, 50 minutes instead of 5 minutes. So what happened there was the chart on the top shot up because that was significantly longer than my other times. And the movement strength was also decreased. So I'm not saying that these have to connect or connect, but what I am saying is it's important to know what's normal for your baby. So I know that 4 or 5 movement strength is normal for mine. So if that changes and decreases significantly down to a 2 or a 1, I'm going to call my provider. Whether or not I got 10 movements or not, I'm paying attention to the strength, and vice versa. I could have a long time, my movement time change drastically, but my strength be the same. I'm going to contact my provider. So it's all about understanding what's normal. But what's great about the app is that you can add notes. It's visual. You can download data and you can share it with your provider or your other home visitors, WIC clinics, however they want to share it. We also have videos on our app. We don't have all of our videos, but just some of our how-to videos, our new features, some of our baby saves, some of our equity work on there. So feel free to watch them with your patients and clients, or say, watch all these videos, and when I see you again, let's talk through this and answer any questions you have. Another great new feature that we have is this Find Help resource. So you will find this on the resources section in the menu bar of the app or on our Healthy Birthday website. And so all users do is they enter their zip code to find free or reduced cost services in their area. So then they can filter even further. Maybe they need financial assistance. Maybe they need help with childcare. They can search those specific needs for free and reduced cost services in their area. It shows a map, it shows ratings. This is a continually updated resource. So if you start using it and you say, wait, all these home visitors should be on here, or all these food banks aren't on here, let me know and we will absolutely get them added. It's a national company that runs this. And so we add the data as I get more data. I just added a bunch of dentist offices that accepted Medicaid. So absolutely share this with your clients and patients. It's a great resource and tool and completely free. Now I have this video. This is on the app as well, but I'm going to share it today. This is just a quick, very brief 1.5 minute video that shares how to use the app in real time. I will note she does say that the app is available in 12 languages. That's because we shot this video before we added 2 additional languages. So it is 14 languages, but let's go ahead and watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So yeah, just a super simple video that you can share. And I see there's some chat, so absolutely feel free to keep adding those questions in there, and we will get to answer those at the end. Okay, we know about the app, we know about the data, we know about the research. How do you implement this? What's next? Before we dive into that, I think it's really important to know that health literacy is one of the strongest indicators of an individual's health status. So these are 5 ways to improve the conversation, and Count the Kicks helps with this. So being equitable, avoiding assumptions, and provide all expectant parents with this information, no matter the race, the gender, religion, socioeconomic status, sexual orientation, marital status, or education level. It's the same information and interaction no matter who you're talking to. Listening and learning. Ask a strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. We'll talk about those motivational interviewing questions here in a minute. Being clear and concise, avoiding long or complex explanations, staying away from medical terminology, considering everyday vocabulary, and then being honest. Speak the truth while practicing empathy and compassion. We can talk about stillbirth with patients. Expectant parents are not delicate flowers. We are talked to things about all over, like what tests we need to take, what blood tests we need to give, prenatal vitamins, not eating soft serve or soft cheeses. So, and then reteaching. If a patient displays confusion or lack of understanding, make sure to correct and clarify, and providing extra support to those who need it. Ask for them to paraphrase what they said, what you said to them. Ask what questions they have. So how do you talk about stillbirth with expectant parents? Again, maybe you're thinking, I don't want to scare moms. Again, like I just mentioned, pregnancy is full of risks that we talk to people about. Stillbirth is another risk that expectant parents deserve to be educated about. Or you're thinking stillbirth just happens. There's nothing we can do. There's warning signs if people know what to look for. And again, a change in baby's movement is one of the first and sometimes only warning signs that baby's in distress. Here is a big one that you're going to get from your patients, probably most likely, and clients is, oh, I don't need to do that. My baby's so active. It's like a jungle gym in there. And I always say the exact same thing to these people. I always say, that's awesome. A healthy baby is an active baby, but it's really important to know if your normally active baby has slowed down, and counting your baby's movements can help take the guesswork out of knowing that. Cord and placental accidents can be sudden, so you really need to know what's normal so you can notice a change. And then kind of a old wives' tale, I guess, that I used to hear, the closer you get to your due date, the closer, everything's going to be fine. But the risk of stillbirth actually increases as a mom approaches or exceeds her due date. What about talking to expectant parents who have had a stillbirth previously about fetal movement? You're going to follow the same protocol. You're just going to start it a little earlier, right? They're already at an increased risk, so you're going to start talking about this at 26 weeks. If you are their provider or you're a new provider, could you read make sure you read the chart before entering the patient room. If you are like a WIC consultant and you just have her background history, or she talks to you about it during the appointment, feel free to ask questions. Acknowledge her child was born still. Ask the name, the gender, if you didn't know, and staying away from medical terms like fetal demise, being empathetic. I think that goes without question. And then finally asking, has anybody talked to them about the importance of tracking fetal movement before? A lot of the lost moms we've talked to have stated that they've had previous live births that went fine, and they had no idea that this was so important. They had no idea that this was a way that baby communicated, and they noticed a change in fetal movement, and they didn't speak up because they had no idea. Why didn't they know? Why didn't I know? That's what we hear all the time. And so we want to turn that why didn't I know into, I'm so glad my WIC consultant told me about this. I'm so glad my nurse talked to me about this, or my OB provider, or I saw a poster in the library. I'm just so glad I knew. So again, you want to talk about at 26 weeks of high risk, 28 weeks otherwise. Here's where your motivational interviewing questions come in. Tell me what you know about the importance of tracking your baby's movements. Let's talk about how to track your baby's movements. Handing them a brochure and say, hey, I just learned about this cool stillbirth prevention campaign. It's empowering, it's got an app, it's all about knowing what's normal for your baby. Let's talk about it. We want you to count each day. You're going to start to learn your baby's normal movement pattern. And I really want you to speak up if you notice a change. If you're not their provider, ask them, do they know how to contact their provider, especially if it's after hours? There should be a nurse number or some way they can get a hold of somebody. And if they can't, or if they live in a rural area where their nearest birthing center is 45, 50 minutes away, they need to go into their nearest birthing center right away, because we know that hours and minutes matter when it comes to this. So again, talking to them about how movements are jabs, rolls, pushes, not hiccups, sharing the app, how it helps them bond with baby. If you're a provider listening today and you do the glucose test in office like we do here in Iowa, that's the perfect time to introduce this. Say, here's your awesome liquid we all have to drink. Drink this before your next blood draw. Here's a brochure, read it, download the app, and then we'll talk about it when you come back for your blood draw. So be thinking of those ways that you can really integrate this easily into your workflow. So let's just briefly go over some other common myths. My baby's always active. We talked about this one. I think it's really important that Count the Kicks gives you real data to show your healthcare provider if you have a concern. Another myth is that only high-risk pregnancy patients should pay attention to their baby's movements. We want all expectant parents to be educated on Count the Kicks and get to know what's normal for their baby. We don't just talk about, or we don't just have people do the glucose tests for those that are more at risk of gestational diabetes. We do it with everybody. Same goes for this. Is a big one. My baby should get 10 kicks in 2 hours or 10 kicks in 1 hour. We hear this all the time. I think because it's really easy to say and remember 10 and 2, but it's outdated. And so current research indicates that moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day. There's a research study on our evidence page on this in particular that, again, if you're really interested in reading research, you can read it, but basically what it's saying, what the research study says is, as human beings, we focus on that hour, right? Like we focus on that ending time. So you know that this is an hour long, you're focused on that. If I'm counting and I normally get 10 movements in 15, 20 minutes, and one day I count and I get 10 movements in an hour and 47 minutes. If I've been told this whole time, 10 kicks in 2 hours, all I think about is the fact that I still got 10 kicks within 2 hours. Even though it was an hour and 47 minutes, I still got it within 2 hours. But that's not my baby's normal, right? My baby's normal was around 15 or 20 minutes. I need to know that so that when it does happen where it's an hour and 47 minutes, I can speak up to my provider because that's not normal. I can use a Doppler device to monitor my baby's well-being. A change of the baby's heartbeat is one of the last things to occur when a baby's in distress, whereas a change in a baby's movements may indicate potential problems before actual changes in the heart rate are detected. So expectant parents should only use a Doppler device under the guidance of their healthcare provider. It's just like when you go in with a change in fetal movement, providers don't just do the Doppler device and send you home. They should be doing further testing. Here's another common misconception. If baby's not moving, I should drink Mountain Dew or something sugary or a Snickers bar to get baby to move. Again, research has moved away from the idea that sugary drinks and the like are a good way to get baby to move, and that kick counts are best monitored without interventions like juice or candy. Because if baby's not moving like normal, parents should speak up to their provider right away. It's just like when you and I are sick. When you and I are sick, we're not chugging Mountain Dew or drinking a lot of coffee. We're laying down, we're resting, we're sleeping. Same with baby in utero. If baby's not moving like normal, whether it's due to infection, umbilical cord, placenta issue, something's happening. Why are we trying to force baby to move if they're not moving like normal? Old wives' tale, babies kick less near the end of the pregnancy. The movements just change, right? They're bigger in there than they were when they were, 24 weeks, but they should still move up to and even during labor. If you have been monitoring your baby's movements around the same time each day, it should still take about the same amount of time to feel 10 movements. If I have any labor and delivery nurses on here today, or or you're in a coalition meeting with them, this is the perfect opportunity to share this information, to put posters up, to hand out a brochure. I went to triage 3 times with my daughter, who took 30 minutes to get to 10 movements. I did not know that was her normal. I did not know that when I was counting that was her normal. My son, who I know we shouldn't compare, right? You shouldn't compare pregnancies. I didn't know this my son would get 10 movements in 5 minutes, and my daughter was sitting here taking 30 minutes. So I went to triage 3 times with her. Everything checked out fine, thankfully. I got sent on my way each time, and she was born at 38 weeks, perfectly healthy. But how wonderful would it have been if somebody would have handed me a brochure or a poster or talked to me about understanding what's normal for my baby, and to speak up then. And then I think there's a misconception, especially around expectant parents themselves, that they should avoid dental care. Good dental care is always important, and pregnancy can increase an expectant parent's risk of dental issues and thus impact overall health issues. So again, think systems change. Could you add information to your discharge paperwork? We have gold standard that I'm going to show you in a second. Can you have all your front desk staff trained so anybody can hand out a brochure? Could you include this in an intake form where you're asking about demographic information, and you know if they're pregnant and they're 20 weeks pregnant when you first connect with them, so you can make a note in your calendar to talk to them about this at their in 8 more weeks? Could you include this with your glucose test? Can you, my favorite, integrate this into an electronic health record so you have a pop-up that comes every time in the 3rd trimester when you're seeing a patient to remind you to ask about fetal movement? Could you add a Count the Kicks message to phone recording for patients while they are placed on hold? There's just so many different ways we can do this. This is our gold standard of our after visit summary. So like I said, I went to triage. This could have been handed out to me about the importance of tracking fetal movement, how to do it, and what to do. If you're interested in this, I can send it to you electronically so you can see how this health system has done it. We're seeing more and more health systems implement it like this. This is an example of a community-based organization that serves around 2,000 expectant Black parents every year in Ohio. And it's kind of a one-stop shop. They talk to them, they provide them resources, and they get one chance to talk to these expectant parents. So they really needed to capture a way to ensure they were at least talking to them about Count the Kicks during that time. So they added this language to this form that people fill out. Electronic medical records and integration, we talked about this. Easily integrated. Every single time you should be talking about this, whether you're a home visitor, you're a nurse family partnership, you're a nurse, you're a doula. Every single time you see an expectant parent, they're in the 3rd trimester, please ask them if they're counting the kicks. Do they have questions about it? How can you help them? This is baby Margot. She said, her mom says, I'm very fortunate that my OB office shared the Count the Kicks information through posters on the room walls and a brochure, as it encouraged me to download and regularly use the Count the Kicks app, which is how I knew that my baby's normal movement pattern had been changed. So anytime we'll talk about the materials here in a minute, but you can put them in bathrooms and rest waiting rooms, just the libraries, anywhere you're out and about, you can share this information. So again, stress the importance of knowing their baby's normal and speaking up if there's a change. Remember, empowerment, making sure they know who to call if they have a concern. Send a brochure home with them or an app card. Share that research shows evening is usually the best time to count babies' movements, but really I wouldn't get too hung up on that. I know that there's different work schedules and things like that. So the most important takeaway is to do it around the same time every day. And then tell mom that the provider should be asking about this. So if they're not, to empower mom to say something to the provider and say, hey, I want to talk about this new app I found, or this brochure that, was given to me by a home visitor. And then here are these questions that you can kind of start with the flow to easily talk about it into your system. So that's baby Eva, so cute. She was a baby saved in Kansas. Let's talk about some resources. So I'm super excited to share that all of the resources on our website are completely free for you. Thanks to our partnership with the Arizona Department of Health Services, you can access posters like you see on your screen. This is what we call our promo poster. We have how-to posters. We have app reminder cards. We have brochures. Our materials are English, Spanish, Navajo, and Swahili. So we have partnered with them, the Arizona Department of Health Services, to create materials in Navajo and Swahili, the very first state to do this. So we're super excited about this. Again, it just goes to show you how important equity is to the people that we're working with at the Arizona Department of Health Services, Laura and Angie and Sheila. And they're completely free. So again, here's what the Navajo and Swahili materials look like. We had some of the images changed. We work with partners within the community to make sure that it resonated with those in the community. So these are completely free to you to order. And now my second favorite part of the presentation is to scan this QR code or go to countthekicks.org, and I'll put it in the chat here. I'm going to play just a minute or two of this song Happy because it's upbeat and it's fun, and we're going to wrap up. But I want you to order materials right now. I want you to see how easy it is to order materials. Go and do it right now. You'll be entered to win a gift card just for ordering materials today. Stock up. You can take them in your car. You can, if you go to coalition meetings, things like that. So I'm going to stop talking for a minute. I'm going to play this song. Come back to me. Like, don't leave. Go place your order, and then we'll wrap things up. Don't worry, it'll start. Oh, it's not starting because I'm typing. Just a second. We'll do that.
It might seem crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you.
Yes, I'll put the link in the chat and give you guys time to do that at the end too. So just click on order materials and then click on your state of Arizona, and everything's completely free. So countthekicks.org. So we'll keep going because we're almost out of time. So we also have another great free resource, thanks to our partnership with the Arizona Department of Health Services, is this free online training, and it's 2.2 CEs. So you guys are the first group to get it. It used to be 1.5 CEs. I will send this in an email so you don't need to draft that or write down that link. But it's completely free with that coupon code there that says Save Babies -AZ. I'll send this to you all, and we just added about a 20-minute session on equity in here in this online training. So absolutely feel free to share this with your colleagues and take this training. Thanks to our partnership with the Arizona Department of Health Services, it's completely free. We have a lot of other great free resources too, so be sure to check out our website. We have a Parent Academy, Provider Academy, those kick counting charts and videos. And one of our amazing resources are our Count the Kicks ambassadors, women who, a lot of them are lost moms who have found us after they lost their baby and said, why didn't I know about this? And I want to change that. And so you are lucky. You have a wonderful woman named Sean, who is your Arizona ambassador, who can come do presentations like this one. She can be in person. She can do media interviews. It's really because of her that we're here too with Arizona Department of Health Services. She's been a longtime connection for them. And we're so excited to be launching here in Arizona. So she couldn't make it to today's presentation, but I asked her to share a message with you all. And so I want to play that now.
My name is Sean Similis, and I've been the Arizona ambassador for Count the Kicks since 2013. I do this work in honor of my son, Zach, who was stillborn at full term on July 3rd, 2010. 2 days before we lost him, I noticed he wasn't moving as much and called my doctor's office. Ultimately, they told me that he was just settling down for birth, which I now know is a myth. Evidence shows that babies do not slow down. They do not stop moving before birth comes. In honor of my son, Zach, I am dedicated to helping prevent the devastating tragedy of stillbirth from happening to any other Arizona families. I am extremely grateful for the partnership with the Arizona Department of Health and look forward to working together to reduce the stillbirth rate in Arizona. Thank you.
So you can contact Sean. She's on our website too, but I'll add her to the email that goes out too. So finally, next steps. I know we're at time, but I promise to get to your questions. Order the materials. This takes 3 to 5 minutes to talk about. Make sure everybody on your team knows about the campaign and the importance of it. Using those electronic health records, those intake forms. And again, remember, hours and minutes matter. Educate patients and staff on how to expedite concerns about movement. And I want to leave you with one more baby safe video. If you'll just stay with me for a couple more minutes, because again, this is why we do this. We do this so we can have more babies just like Nala on this earth with us. So let's watch her story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh, man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. Just pay attention, you know, seriously. Like, it's your baby's life.
So connect with us. I love what she says there at the end when she says, go check on your baby. Don't worry about anything. That's so important and good advice. So you can connect with us, sign up for our newsletter, email me. I'm sorry we went just a couple minutes over, but we started a little later. So I'm so glad that you joined me today. And I hope you found this beneficial and that you take this time to order materials and talk to your expectant parents about it. I am going to just look through the questions and answer them. And this is all being recorded, so this will be sent out. So if you do have to jump off, you can go to the last part of this as well. So let me just see, we have a Q&A. Can we get a copy of this PowerPoint? Yes, I will send that out when I send out the email, probably within the next day or two. Letitia, hopefully I probably butchered that, but yes, I will email you. Let me see these questions here. Okay, so I think if baby kicks 3 times right in a row, does that count as 1 kick or 3 kicks? I would probably count that as 1 kick and move to the next one, or, you know, it's really up to the mom to decide what makes sense for her. If that's kind of how baby moves and it's 3 quick kicks right there, she can count that as 3 kicks. So it's really up to her to decide. what counts as like one movement versus 3 movements. I haven't seen any research that shows, right in a row like that, of how we would do that. So I would push that on mom to say, do you think that's one big movement, like one kick, or 3 multiple ones? Yes, this will go out in a recording. And I'm sorry, Letitia, if I pronounce your name wrong, I apologize. I will connect with you and get this information right on the Find Help resource. You can actually claim your own organization, so you can update that information yourself. But I will make sure to connect with you. Heather says, love this. Can't wait to start spreading the kicks. Oh, thank you. For Navajo, yes, I'm so glad you guys love it. Put the link. I am pronouncing it correctly. Oh, good. All right. I think those are all the questions. If you have more, I'll stay on for a couple more minutes. But you're free to go. Again, I will send out an email with the recording, with the PDF of the slides, and a couple other links that we talked about today. So yeah, thank you again for your time today. I really appreciate it. And I hope you all have a wonderful day, enjoying your 70-degree weather or cooler, depending on where you're at. Well, we're at 90. So happy counting and happy spreading this information. Thank you. I'll see you for just a couple minutes. Hey, Angie.